you step up to the line there, and the object is to throw the bean bag, and you're wanting to aim for the 200. You're wanting to aim, but you can get whatever.
Okay.
Whatever point. Do you
on,
want to go
Deb,
first?
Yeah.
Alright, step up to the line here.
What do you think?
Yay.
Any advice? Underhand, overhand?
Whatever.
Any way you like. You're the minister.
Okay.
A little closer,
Okay,
it's
let's go
easier.
close as I can get. Okay, you watch this, guys.
1, 2, 3.
Wouldn't say but
If it doesn't stick, you don't get the point?
Nope.
no way.
That's
right,
okay.
guys?
You have
Nothing
2 more
to prove,
tries.
eh?
Oh,
You have 4
okay.
tries.
Nothing
Maybe
to
under.
prove, yeah.
Underhand's better?
I tried either way.
Okay, I'm gonna go underhand
I'd
now.
give it a shot.
Hey! There you go.
Very good.
One more.
I have a new career.
One
I
more
think the
shot.
Blue Jays are looking for me. What do you think?
Well, good morning, everyone. Nice to see everyone this morning. Nice to see so many providers. Thank you for the warm welcome from Salvation Army. Deborah, Nancy, Glenda, Patricia, very warm welcome today. And as I said to them when I was coming in, I actually came and did a tour of this facility when I was a cub. So I lived in Northeast London, and it was at that time it was like an orphanage with children who were taken care of here. So it's evolved considerably since then to now providing services for seniors and adults with developmental disabilities. So great transition. And I said to Jeff as well that also nice to see how well the facility's been kept. Like it looks pristine and well kept. So congratulations on that. So I'm Mike Barrett, I'm the CEO for the Southwest LHIN. Again, thank you for coming, everyone. We're pleased to join the Honorable Deb Matthews today to make this special announcement that will impact community health care and mental health and addictions across the Southwest LHIN. And again, as I look across all these faces I see in the audience, all of you have played such an instrumental role in delivering those services to the patients, clients, and residents that we have responsibility for. You'll hear from the Minister that there's a shift in terms of how the government is making its investments. It's that shift to provide more care within home, more care within community, shifting it from acute or from hospital and making sure that we can take care of people within the community. And the LHIN is part of that shift. We have the responsibility to ensure that people are getting the right care in the right place at the right time. In order to do that, we need to make the decisions, our board needs to make the decisions to ensure that those funds are getting to the right place. The government, the minister and the government have entrusted us to make these decisions on a significant amount of money that we have responsibilities for with our hospitals, long-term care homes, the CCAC, community mental health and addictions, community health centers, community support service agencies. All those organizations, the government has entrusted us, the LHIN, to make sure that we're making the right decisions. They rely on us to make those decisions based on our knowledge of the local healthcare system, of our relationship with the local health service providers, and we have 150 health service provider organizations that we fund across the Southwest LHIN. So we're very pleased today to be part of this announcement with the Minister and with the Honourable Chris Bentley to talk about the projects and initiatives that have been, that will be funded and will have a great value and a great benefit to all the patients and clients across the Southwest LHIN. So again, thank you for coming today, and I'll call on the Honourable Chris Bentley. Chris, as all of you know, is the Minister of Aboriginal Affairs, the Minister of Energy, and also our MPP for London West. So Chris. Thank you.
Well, thank you, Michael, for you, the people in the LHIN, for the work that you do in making sure that we can deliver the right type of care to people at various stages of life. Thank you very much. And to all the providers as well. It's great that we're here to celebrate and recognize the work that you do. Enormously important. Our system is coming together as a system. Delighted to be back at the Salvation Army. I remember just a few years ago, Deb, we were at a groundbreaking for the new child care facility and got a tour here. And the Salvation Army has always reached out and helped people at all stages. The youngest, and those of us who are mature. And I know one of the things that the government and Deb in particular has been very focused on is making sure that as we mature, we get the right type of assistance, and we are able, should we choose, to stay in our homes or apartments for as long as we wish to. And that hasn't always historically been the case with care for those of us as we're maturing. And it's really required a huge shift in thinking. And I know Deb, as the Minister of Health and Long-Term Care, has been leading that shift. And I have a funny feeling that today's announcement has something to do with that. And so can I introduce my colleague, the MPP for London North Centre and the Minister of Health and Long-Term Care, Deb Matthews.
Thanks, Chris, and your intuition might just be accurate. You know, I am delighted to be here at the Salvation Army. The people at Salvation Army are extraordinary people. They are givers, and no matter what challenge they undertake, the Salvation Army is there to help people, the people who need it the most, and often the people who are not getting the attention they deserve. So I just want to say thank you to those of you from the Salvation Army. I am delighted to be here. You know, I think the first time I came out to this village was so many years ago, because my mom was a member of the Salvation Army Auxiliary. My dad was on the board of the Salvation Army, and my mom brought me out here for a meeting of the Auxiliary when I was probably still in my teens, so that'd be at least 10 or 15 years ago. And it's, you know, this is just, I think this is Canada at our best. So thank you. This is an enormously special day for me, and I'm going to explain why. We've been working really hard to change how we deliver health care, to do a better job providing care for people, the very highest quality care, getting the very best value for the money, to support people through their health care journey, to wrap services around individuals. So we've made a number of changes over the past few years, and to me today is a culmination of those changes that demonstrates when we do things differently, we can really drive better care for people, and we can drive better value for money. So the first thing that I think of, an essential ingredient that got us today, was the creation of the LHINs. The work that the LHINs do at the local level, understanding the needs of local communities, understanding the potential and the opportunities, and then attaching money to where the need is the greatest, to where we'll get the best value, is work that could not ever have been done out of Bay Street in Toronto. So today is a celebration of the LHINs. It's a celebration of the ability of LHINs to understand and respond to the needs of the community. The other thing that today is a celebration of our government's determination to be very, very strategic in where we put resources. You know that our economy is pretty tough right now. We're fighting back. We're determined to reduce our deficit, to get back to balance over the next 5 years. That means there's not a whole lot of new money out there. Our government did decide, however, that education and health care would continue to get increases in funding, nothing like we've been used to in the past, but we would continue to invest more in health care and education. But we were going to need to shift where we were spending money. So we made a pretty important decision last budget. We said to hospitals, sorry, but a 0% base increase to hospitals. So I know that's tough for hospitals, and I know they have to make tough decisions, but we needed to be strategic with the additional money we had. We also had to say, on the pharmaceutical side, we're paying too much for drugs. So we have to pay less for generic drugs. That's saving us, our decision to take on that challenge is saving us $500 million a year. That's money that can be spent in a way that helps patients more. We've said to our doctors, we're going to have to really work hard so that we're going to have to work within the budget we have when it comes to paying doctors. So we had to really make some tough decisions for one reason, and that's what brings us to today. We said any additional money we have to spend in healthcare must be spent in the community. It must be spent where it's going to make the biggest difference for people. So we said to our LHINs, we're going to hold the line on almost everything we're doing in healthcare with the exception of the community sector. We're going to increase the community sector by 4% a year for this year, next year, and the year after that. So LHINs, go out and figure out where that money is best spent. We set priorities. We said get those ALC rates down. So ALC patients are people in hospital who shouldn't be in hospital, who could be cared for at home with the right supports. We said we got to do a better job on mental health and addictions. So you go understand the needs of your community, understand where strategic investments are going to make the best difference for patients. So here we are today. We are now at a point where we can say where that additional money has gone, it will go. I want to say thanks to the LHIN, to Jeff and to Michael. You had to make some really difficult decisions. We know that there's a lot more demand than there are dollars. But you did have to you did have to go through a process where you determined where the best value for money was, where the most people could be helped with the dollars that we do have. So let's talk about where the LHIN landed. I'm delighted that the highest priority was given to Home First. Sandra Coleman, the CCAC, has been a provincial champion for Home First. And I want to tell you that I was invited to speak in Washington, D.C. last week at an international conference. They wanted me to come and tell these health ministers from around the world what we were doing in Ontario and how we were getting such great improvement in our healthcare system. I talked about Home First. So, Sandra, know it or not, you were at an international conference in Washington just last week. So, Home First is a marvelous, marvelous program that has totally transformed the way we look after people who, mostly elderly people, who come into hospital. We would have, just months ago, we would have said to people when they come into hospital with a broken hip or with a stroke or with something that sets them back a bit, we would have said to their families and to those patients, next stop for you is long-term care. You can't go home. That was devastating for families, devastating for individuals. And what Sandra and the CCAC has demonstrated is that not everybody needs to go to long-term care. Lots of people can go home from hospital. Lots of people can, with the right supports, get healthier again, get able to stay where they want to be in their own homes for much, much longer. We've seen the demonstrated success of Home First. We've seen ALC rates in hospitals with Home First drop significantly. The LHIN has decided that this is a program that needs to be expanded. So a very high priority of the Southwest LHIN is expanding Home First to Tillsonburg, Owen Sound, and Woodstock, and to continue to expand in Elgin and London. That is a great investment. Better for patients, better value for money. That's the sweet spot for us all. Palliative care is another priority. Cheshire is working with their clients to prevent hospital admission, to prevent premature admission to long-term care. We've got 8 adult day programs. That's why we're here today. We're expanding adult day programs here at the Salvation Army from 3 days a week to 5 days a week. People will get respite care. It's great for the individuals who come. It's also great for their families and caregivers because it gives them that needed respite. Up in Grey Bruce and here at the Salvation Army, more day programs. I know McCormick Home is also expanding services there. People need to get here, so there's more money for transportation from Boys and Girls Club and VON, home help through the VON, more supports for people with acquired brain injuries, Dale Brain Injury Participation Lodge in Grey County. We've got outreach attendance services to help people get the care they need at home. And we've got a terrific investment in mental health and addictions. We know that we can do a lot better when it comes to caring for people with mental health and addiction, to give them the support they need to get on with their lives. And I'm delighted that Watch and Mission Services, SOHAC, Choices for Change, Addiction Services Thames Valley, Hope Grey Bruce, and a range of other services are getting additional funding to address the needs of people struggling with mental illness and addictions. So, well done, team. You've done a terrific job. The good news is, we're here today, expanding services in the community. Even better news is that this is a commitment not just for this year, but the year after and the year after that. So congratulations to all of you. This is a real turnaround in how we deliver health care. This is essential to the transformation that we need in our healthcare system. Better value, better care for patients. What it means is that we're going to be able to protect and strengthen our very, very precious Canadian, uniquely Canadian universal healthcare system. Without this kind of change, we simply would not be able to do that. So congratulations and thank you, every one of you, for making an extraordinary contribution to the wellness of the people we serve. Thank you.
Thanks very much, Minister. This is exciting news for all of us and all our patients, clients, residents across the Southwest LHIN. And when we meet with the Minister, she often says, tell me what it means to the client, or tell me what it means to the patient. Don't give me the health system, lingo from an organization standpoint. So what we try and do, we try and tell a story on our website. So we have a lot of videos about Home First is prominently displayed there. But for all the new initiatives that we're investing in this year, you'll see additional information so that members of health service providers and the public can come and see what it means for the patient, client, and residents. So thank you. And we'll strive to live up to yours and the government's expectations around these investments that you've entrusted us to make. So thank you. Our next speaker is Jeff Lowe. Jeff is our board chair for the Southwest LHIN, and we're very lucky to have Jeff as our chair within the LHIN system. He's a former board chair at London Health Sciences Center, so certainly understands the perspective of the hospitals, and now broadening that perspective coming into the LHIN system. So I'll call up Jeff to say a few words.
For some cruel reason, I'm always asked to follow the minister. What can I say? This really is a day for celebration. It's a great news day, and it really belongs to everybody in this room. I can't tell you how much pleasure it gives me in representing our board with you today to talk about issues that impact in a positive manner so many people that have so much need in our community. Today's all about supporting people to stay in their homes rather than in long-term care facilities. And these decisions that we've taken, and the minister referred to them, they were not taken lightly by our board. There was a lot of discussion. I can tell you there's a lot of debate. And in the end, our board has chosen to focus this money, over $14 million, in the two major areas that the minister's spoken about, that being access to care and mental health and addiction. And there are two very needing areas that we're aware of in our community. These investments will allow us to target those priority populations, the at-risk seniors, people with mental health issues and addictions, and children with complex health situations. And just as important, to support people staying in their homes where they want to be. In the Southwest and elsewhere in the province, and Minister Bentley referred to this, we have an aging population. The man standing before you is a good example of that issue. And that's why adult day programs are so important. We're pleased that the Salvation Army Adult Day Program is receiving an additional $140,000 to provide services to older adults with Alzheimer's and other dementia. We're also investing in the Boys and Girls Club. to allow them to provide 3 additional buses for moving people around. And while today's announcement is great news, it's just the next in a number of steps that are being undertaken within this province by a ministry that gets it and by a community that gets it and what goes on and what's important to people in Ontario. So on behalf of the entire board of directors of the Southwest LHIN, all of our directors, all the staff, Mike and his team who work day and night, I can tell you, and weekends to provide the service that we are able to provide. I want to thank you all for being here today for this good news. Thank you for all that you do. And I live here too. This is important, so thanks again.
And as the minister announced, the funding that's going out is going to a number of different providers across the Southwest LHIN. And is Dick Barreps here? Dick is actually the board chair of Home and Community Support Services in Grey Bruce, and he was going to come down today from Owen Sound, and I hadn't met him, so I must have been able to make it. But so we have providers from across our geography that are getting funding today. One of our partners is obviously the Southwest Community Care Access Center, and the CCAC has the same boundaries as us, a close partner of us in terms of the delivery of programs and services that we provide. So Sandra Coleman's here and is going to speak to the good work that they're doing.
I'm very honored to be here, and it is, I liked the theme of your remarks, Deb, as well as Jeff and Michael, around the journey that it's taken to get here. And I think it's a snapshot in time. We're together 20 minutes or something this morning, but I think back to a long, long journey. And I think back to October of 2003, and the very first meetings where a board member and I came to see each of you, Chris and Deb, and having the discussion we would have had with umpteen members of Parliament about how hospitals do such important, valuable work, but that there was this other part of the healthcare sector of community and mental health that didn't have the same profile by sheer nature of dollars and not having bricks and mortars with big letters on them and not having lots of high-profile fundraising, etc. And that therein, I would have said, lies the magic. You use the word sweet spot, but that therein lies a solution when there aren't a lot of solutions to some of the difficult challenges that we have. And I give you both full credit and the government full credit, because many people have those conversations and many people not. But I can't think of a government and a minister who has gone on to take the kind of actions and make the difficult decisions that you've made. And it's not just been a one-off today, it's been time and time and time again. And your 4% over 4 years is a huge symbolic part of that. But there have been so many other decisions that you have made that have fundamentally reframed the entire thinking about where healthcare needs to go. The vision and the direction and the priorities are all different because of your thinking and your leadership. So from the bottom of my heart and from our 60,000 clients a year and the many, many other thousands that are represented by the community providers, we thank you for really taking action and leadership to follow up on what otherwise could have just been nods. So we thank you for that. And I also want to thank the LHIN. This LHIN gets it in terms of the commitment to home and community care. They were demonstrating that long before even some of these funding announcements came along. And when you look at the composition of their board, when you look at all the area provider tables and the various committees and leadership structures that they put in place, the extent of the engagement that they undertake, and the time and attention that they pay to the home and community care sector, we had the ingredients for success here, that once you put the enablers in place, this LHIN, with the partnerships of the people in this room, are able to make change happen fairly quickly and demonstrate the profound success outcomes that you have started to share. And I'll just add, on behalf of the Southwest CCAC, I have to thank all the community partners that are here. Home First, the reason for its success is in fact because it may take a village to raise a child. It takes everyone in this room to make Home First work. And you've recited some of the most important statistics. I won't bore you with more, but just to share, if I may, a very short client story, if I could talk about Kate for a moment. Kate is a well-known success story around Home First. and a woman who sat in hospital for 3 months because of a fall that ultimately took her there, but of course had many other complications that made it very, very challenging to imagine getting her back home. And for those 3 months in hospital, all of the conversation with staff was around fill out the long-term care home application process, make your choices, and that's your inevitable journey. But because of the introduction of not just Home First as a program, but as a different way of thinking, instead the conversation shifted to be around what would it take to get Kate home, and how can the partners come together in order to get Kate home. And because of that change in thinking, backed up by a change in practice and then enhanced service levels in the community, working with a lot of people in this room, we were able to get Kate home. And someone who otherwise would have gone to long-term care instead now isn't just stabilized and receiving supports for daily living and living independently in her home. Beyond that, she's playing the piano again, she has her license back, and she's painting again. And that Kate is a documented story. There are now thousands of stories like that, and with the additional funding that is being received by many people in this room, we will be able to have thousands more stories like Kate. So thank you to the minister, thank you to the government, and to Chris and your leadership, to the LHIN, and to all the community partners in the room who make this happen. I'm very honored.
Thanks very much, Sandra. Our last speaker is Patricia Finney, and she's the Divisional Secretary for Public Relations and Development at the Salvation Army. And again, we've had a very warm welcome today, a great partner of ours in terms of delivering the Adult Day program. So please come forward and welcome your comments.
Thank you.
Well, there's no question that today is a very exciting day for the Salvation Army. And we are absolutely delighted to welcome you here this morning, and that the Southwest LHIN chose to host this event here at the village. And we're just so pleased to see so many of you here. We greatly value our partnerships in the community and all of the stakeholders who make this program possible. We greatly value our partnership with the provincial government. We're so grateful that you've recognized us as a worthy partner to help deliver these very valuable services. And Minister Matthews, I couldn't help but think as I was sitting there just now that with an additional 2 days a week, these folk are going to become so skilled at that beanbag toss that they're going to be very stiff competition next time round.
They already are.
They already are. So you can just imagine with 2 more days practice each week. Well, we've all read and heard reports that tell us that the prevalence of Alzheimer's disease and related dementia will continue to rise rapidly with our growing and aging population. And this means that each and every year, individuals from families, your families, my family, will be affected by these diseases and will become dependent on the healthcare system for help from the time of diagnosis through to end of life. In London and Middlesex alone, there are currently over 9,000 individuals who have been diagnosed with Alzheimer's disease and related forms of dementia. With this in mind, as has already been stated several times, it is critical that supports are in place throughout all levels of the healthcare system to support people in the right place, at the right time, and by the right people. With the pressures that are on the system, it is especially important that services are in place that enable people to remain in their homes and be appropriately cared for as long as possible. The Salvation Army London Village has been dedicated to providing specialized services to individuals and families affected by Alzheimer's disease and related dementia since 2006. Our daytime service has been operating over capacity with a wait list for 5 years. We've been waiting for this day. The program provides an opportunity for individuals to benefit from participating in a variety of social, recreational, spiritual, therapeutic, intellectual, and physical activities offered in a structured home-like environment. All activities are age-appropriate and are planned to meet the varying interests and levels of ability of each person. Families benefit by knowing that their loved one's personal care and nutritional needs are being supported while they themselves receive a welcome respite from their caregiving responsibilities. This announcement today is very good news for the Salvation Army. As we've indicated already, the Adult Day program will be able to expand starting, I believe, Nancy, in January, going from 3 days a week to 5 days a week. This will provide up to 30 new spaces each week, resulting in over 1,300 additional visits to this program each year. Do you know, this announcement today is also very good news for the families in our community who need these kinds of supports. And for the folk who come here each day, they love to come. They'll be absolutely delighted that they are able to come for those additional days. We are very grateful to the Government of Ontario for recognizing the important role that all community support services fill within the healthcare system. And we at the Salvation Army are especially proud to include dementia-specific services as an important part of our mission now and moving into the future. Thank you so much.
Thanks very much, Patricia. And that concludes our formal part of our presentation today. The Minister and Honourable Chris Bentley will be available for any interviews or comments or questions or discussion if you'd like after this session, and as well as all of our providers. So we have a whole room of providers here that are, I'm sure all of them are receiving funding through this significant announcement, and all of them have a story to tell, similar to what Sandra spoke about the impact for clients with the CCAC, similar to what Patricia said about clients that are served by the Salvation Army. All of them are seeing that impact. McCormick Home, CMHA Elgin, Watch, all these organizations, and I shouldn't have started listing them because I don't but I'll repeat what I said before, Minister, is that all of us, the LHIN, all the health service providers here today take your expectations very seriously, and we'll ensure that we continue to deliver on those expectations to improve the quality of care and to deliver high quality care to the patients, clients, and residents across the Southwest LHIN. So thank you.